The IFCR's CDKL5 Centers of Excellence help affected families access a team of multidisciplinary specialists. The clinic model eases the burden on families by bringing all specialists together, saving families time and hassle while ensuring that their medical team is able to work together. Each CDKL5 Center of Excellence team consists of a variety of specialties, including, but not limited to, epilepsy, genetics, gastroenterology, physical medicine, rehabilitation, and palliative care. Our CDKL5 Centers of Excellence work to continually advance our understanding of CDKL5 deficiency disorder. They are researching how the condition unfolds so that standards of care can be developed for this disease. IFCR sponsorship makes the CDKL5 Centers of Excellence possible. We provide the coordination that brings the specialists together and fund the multi-center research. Hear from Dr. Judy Weisenberg about what you can expect when you visit the CDKL5 Center of Excellence in St. Louis, Missouri.
Judy, and I'm the proud co-director with Dr. Robin Reither of the Red Spectrum Clinic at Washington University and St. Louis Children's Hospital. The clinic opened in 2015, but I have had the privilege of caring for patients with CDD since 2009. Here are a few questions and answers about our clinic. What do you have to offer families at our COE? Our COE provides multidisciplinary care as well as opportunities for research and education for patients of all ages with CDD. What is a typical visit to our COE like? Every patient who comes to our COE is seen by myself, a pediatric neurologist and epileptologist, a physical therapist, occupational therapist, augmentative communication team, dietitian, and, if needed, equipment specialists. If there is a need for other specialists such as gastroenterology, genetics, orthopedics, ENT, sleep, cardiology, and gynecology, we have identified individual specialists for both pediatric and adult patients and can offer appointments with these specialists as well. Particularly for families coming from a long distance, we make every effort to coordinate those appointments over 1 to 2 days. How much does it cost to visit our COE? Is it covered by insurance? We do charge medical insurance as any doctor does, and you may have a copay with the visit depending on your insurance. We do our best to confirm whether your insurance is within network prior to the visit. How can families advance CDKL5 research by visiting our COE? All families who visit our clinic will be informed of research opportunities that they can choose to participate in or not. Research is completely voluntary. Currently, we are enrolling as part of the ICCRN, an NIH-funded study that is trying to develop better outcome measures for CDD. If a family cannot travel to your COE, is there anything your COE can do to help them? For example, can you consult with their home team? Other things? In general, it is our preference to see a patient for the first time in person. However, we can offer neurology telehealth in the states of Illinois, Missouri, and Minnesota if absolutely needed for the first visit, and regularly offer this for follow-up visits. I am also happy to discuss particular questions with home or local neurologists or other local specialists as needed. We also host an annual education seminar that is free of charge and has been offered virtually or hybrid for the past 3 years. What do I like best about seeing CDD families? I have loved caring for these patients from the first moment I knew what CDD was. It's important to me to get to know the entire family. Families have taught me so much both about medical care and life over the years. What's fun about a COE visit? Everyone enjoys socializing with other families in our waiting room. Sadly, this has not been happening since the pandemic. I also know that families love seeing our amazing nurse coordinator, Wendy Sanders, who many have entitled an angel on earth. To know her is to love her. What's fun about a visit to St. Louis? We have wonderful zoos and family-friendly museums right across the street in Forest Park, which actually have free admission. There's tons more to do for families too, from Grant's Farm to the Butterfly House and the City Museum. Don't forget to try some custard at Ted Drew's or toasted ravioli. Dr. Reither wanted me to make sure I invited you to a Cardinals or Blues game, and don't forget the new soccer stadium.
My name is Sam, and this is my mom, Dr. Judy Weisenberg. She is a pediatric neurologist and epileptologist. That means that she takes care of kids with seizures. She also helped create a clinic for families with CD and CDD. But I'm gonna let her tell you more about it.
Thanks.